there are a number of methods that we've mentioned earlier, and now we're going to talk with Dr. Ruberu about how to choose the method that is right for you and your couple. So Dr. Ruberu, describe, first of all, what are the main methods that are available?
So there are really three types of methods that all of these natural family planning methods kind of fall into. And that would be a mucus-only method, or it would be a mucus and temperature method, or mucus and looking at the actual hormones.
Okay, good. So three main methods. Why did you choose the method you chose?
So there are certain methods that are more standardized, which can be used not only to achieve and avoid, but also to address all the GYN issues. And that's the method that I chose because I'm trained in NAPRO technology, and that's what I do on a day-to-day basis. So it made the most sense for me to use Crichton Fertility Care, Natural Family Planning, and NAPRO technology.
Okay. Now, if you put yourself in the shoes of a young woman who is considering a method, what should be some of our questions or thoughts or reason to choose a method versus another?
Sure, absolutely. So I think the first thing would be maybe paying attention a little bit to your cycles and seeing, number one, do you have any medical issues that need to be addressed?
Okay.
And if you have abnormal bleeding, irregular cycles, PMS symptoms, heavy bleeding, anything that is concerning to you, then you might want to consider looking at Crichton first, because in that way you'd be able to achieve and avoid as well as address those issues easily. If you have a completely normal cycle, 27 to 29 days, you don't have any painful periods, you don't have any heavy bleeding or spotting in between your cycles, your moods are normal, you're not having any increased issues with anxiety, depression, problems right before your periods, then that would kind of open up the door to looking at all of the other types of methods. If you're going to look at the methods, if you're somebody who's more techie, someone who wants to have a gadget or something to use, then you might want to look at something that incorporates more of the hormonal testing, like a Marquette method that looks at the hormones in your urine. Same with the FEM app, that's a similar sort of idea there. If you're someone who doesn't mind getting up first thing in the morning and checking your temperature and you just want as much data as possible, you can always add in with the symptothermal method. They look at the temperature, as well as you can look at the position of your cervix, you can look at your mucus findings, and you can chart all of this. So it kind of really depends on your personality and what you would be comfortable doing or looking at.
Now, you talked about medical protocols for Crichton. FEM does have some of those too as well?
Correct. FEM also takes a lot of time and effort to just paying attention to your moods and your bleeding patterns and your mucus patterns and everything else. And when you are, looking at the hormonal charting as well with FEM, you can utilize that too. Just in my experience, Crichton is very specific in its language, and the way that people are charting, it makes it very easy for NAPRO-trained doctors to be able to instantaneously understand exactly what the quality of the mucus or the bleeding or anything else is.
What about, symptothermal, couple leak, SymptoPro, how is where are some of the reasons to use or to learn from them that you have seen that are beneficial?
Yeah, it's a really, they're all great methods. They all teach, to be able to identify that time of ovulation and the likelihood of achieving or avoiding pregnancy at those times. So they're all great for that. And it might just be even who you already have a relationship with. If you know somebody who is a teacher for one of those methods and you feel comfortable with that person, that's definitely a reason to kind of move in that direction to help you to navigate that situation. So
you make a great point. It's actually because it's such an important relationship when you start working with someone to teach you this information that maybe that is the reason you choose a method.
Absolutely. If you feel comfortable with the person who's teaching you, you're more likely to be able to communicate and explain everything that you're experiencing.
And now, so they could be local or they could be
at a distance.
On a distance.
Yeah.
Okay, good. Great. Well, one more question. why would it make sense, or sometimes a woman might start with a method and change method. Can you talk a little bit about that? Sure. And why?
Yeah, there is never an issue with getting as much information as you want to get. So oftentimes we'll have patients who start off with one method and then they realize that they'd rather, check temperature instead of, using a clear blue monitor, because maybe the use of the clear blue monitor, it costs $40 every 2 months, and that might be financially too much of a burden to carry on long term. Initially, they just wanted to use that monitor so that they could have some comfort to really make sure they were checking at the right time and that they were identifying ovulation at the right time. So you can, once you have an understanding of the methods and you've worked with different people who can teach you those methods, you have the freedom to incorporate whatever aspects of whichever method you like, and you can kind of do your charting accordingly. So I have many patients who take a little bit from Crichton and they might chart their bleeding patterns and their mucus patterns according to the Crichton way, but they also use their FEMAP, or they also, it all depends on kind of where you are, what the importance of achieving or avoiding is to you at that time. If you're a fertility patient, then obviously you're going to put a lot more time and effort into making sure that your mucus is as good as it can be, and you want to be able to document that in the most in-depth way possible. But if you're somebody who conceives easily and you know when your mucus is present and when it's not, then you're more concerned about what are the borders of that fertility, and when does it start and when does it end. The actual quality of that mucus isn't as important to you at that time.
Thank you for watching this video. If you would like to learn more, go to naturalwomanhood.org and be empowered to learn about your body and your fertility and take charge of it.